Hello everyone, myself Dr. Vipin Khatkar. I'm Senior Consultant Orthopedic in association with IU Health. Today I'm going to speak about very neglected and upcoming topic, that is sports injuries. So first you have to prime your body. You start with proper warm-up sessions. Before doing any sports activities, you have to warm up your body so that your body knows that you are going for a sports session and it is ready for it. Many people don't do warm-ups and they start straight away go for the activity and they end up injuring their joints or ligaments or muscles. Then rest to the body. Whenever you are into a strenuous sports activity, professionally or even for recreation, you should give your body a proper rest so that it gets time to heal whatever small tissue ruptures or sprains are there. Keeping the body hydrated during the time of sports activity is a must. And if you injure your any part, any joint, any ligament, any sprain occurs, you should not neglect it. Don't first line of treatment that comes in an acute injury is, as generally we say, is a RICE treatment, RICE. So that is rest to the part. You take the pressure off the joint. You take the pressure off the injured part. You don't use it. Then comes the ICE part, which takes away the swelling. So ice packing is done to the part so that the swelling is reduced or controlled. Then comes the compression, which is given with the compression bandages or crepe bandages, and elevation. Elevation is around 6 to 10 centimeter above the cardiac level. You keep the limb so that the swelling subsides. So this is the RICE treatment, is self-administered. In general, population can do whenever there is an acute injury that happens. So after talking about prevention and self-administration of treatment by the patient for acute injuries, coming down to when should you see your doctors. There are some injuries, especially in high contact sports, which are high velocity injuries leading to ligament ruptures, complete tear of the ligaments, which leads to instability of the joint, which leads to dislocation of the joint, which may lead to even fracture. So in these cases, you have to come to the hospital, you have to see your doctor, where the doctor there are a series of tests which will be done, including MRI or CT scan or X-rays, and accordingly the treatment is planned. Especially for ligaments, like in knee, when we talk about ligaments, there is ACL, there is PCL, there is MCL, there is LCL. All these are primary stabilizers of the knee joint. So these ligaments, when they are ruptured, they need to be surgically reconstructed to re-stabilize the knee joint. Otherwise, the degenerative process sets in the joint, which is not good for the patient. So then there are other cartilage loss. Sometimes there might be cartilage loss, there might be meniscal injury. For shoulder, coming down to shoulder, there are labral tears. There is when the dislocation happens, there are labral tears. There is rotator cuff injury, which needs to be addressed surgically. Now for surgical part, all these injuries can be very well managed by arthroscopy. Arthroscopy is a technique. In a layman terms, it can be said it's a keyhole injury. We don't need to cut the whole of the joint, or long scar incisions are not required. Simple 2 or 3 portals with 1 stitch each, we can get inside the joint, and looking on the TV screen, we can treat the injury, we can address the injury, we can go and repair it. So these are the advances in sports medicine. So takeaway message for people at large, population at large, would be, if you are very active sports person, for professionals, it's okay, they are under guidance, they are under their mentor, they do their activity according to the norms, and they are very well wise with the process. For in general population who take up sports as a recreational activity, they must choose their sports wisely, they must use proper equipment, they should follow all the advice which I have given, like warm-up, hydration, rest, and you can prevent injuries. But unfortunately, if you are injured and you face problems like instability or painful joint or painful pop-ups of the joint or dislocation, these conditions need to be addressed by the doctor at the earliest so that further damage to the joint can be prevented. Thank you.